Hi, I'm Casey Woster, and this is a lightning abstract presentation. I will be describing our study, which simulated adenosine administration with agitated saline to compare three commonly used adenosine push techniques. As a background, adenosine is highly successful in terminating SVT. It is vital that the adenosine arrives to the heart quickly, as its half-life is less than 10 seconds. Multiple techniques exist for adenosine administration, but little is known about which may be superior. As ultrasound has been shown to effectively confirm IV placement as well as detect cardiac abnormalities using agitated saline, we decided to use this in our study. Our objective was to compare the timing of three documented adenosine flush techniques with agitated saline being a surrogate for the adenosine, and ultrasound confirming the arrival of each flush to the right heart. Briefly, these were our methods. A 20-gauge IV was placed in the antecubital fossa of each participant. These participants were without known acute or chronic cardiopulmonary problems. Two RNs worked in tandem to agitate a saline bolus and administer it via three techniques. This was standardized and randomized prior to administration. An ultrasonographer, who was blinded to the flush technique via a divider, confirmed flush arrival to the right heart using the most optimal cardiac window. The windows included modified peristernal views, apical four-chambered views, and the subxiphoid views. Each of the flush techniques was performed 3 times on each participant for a total of 9 flushes per participant. A research assistant did the timing and the recording, and from this a mean time for flush arrival was calculated for each technique. The first technique was referred to as the rapid push. A volume of 2 milliliters, simulating the volume of 6 milligrams of adenosine, was agitated and quickly pushed in the IV. This was immediately followed by a 20 milliliter unagitated saline flush in the same port. A stopcock technique required the use of a stopcock to push 2 milliliters of agitated saline by 1 RN. The stopcock was then toggled with an immediate push of an additional 10 milliliters of unagitated saline in a separate port by the other RN. Finally, in the combined technique, the 2 milliliters of agitated saline was combined with 10 milliliters of unagitated saline in the same syringe and pushed together. Here's a summary of our results. There were 20 participants. The stopcock technique was the fastest at 2.96 seconds and was significantly faster than both the rapid push and the combined techniques. There was no difference between the rapid push and the combined techniques. This figure further details the results. A small diamond is the mean, with the shaded boxes showing the range of values, and the T-shaped lines extending from those boxes being confidence intervals. There are also small circles representing outlier values. As mentioned before, the stopcock techniques were the fastest and had the most narrow confidence intervals. In this table, we again demonstrate the breakdown between the three techniques, with the stopcock being the fastest and the rapid push and the combined techniques being slower. Finally, the times obtained by each of the three sonographers for the three techniques were compared. Sonographer A was an emergency medicine resident, and sonographers B and C were attending emergency physicians. There was variation amongst the sonographers, but the stopcock technique was the most rapid for each. In conclusion, a bolus of agitated saline designed as a surrogate for adenosine arrived most quickly to the heart when it was administered via a stopcock technique. There are limitations to our study. Most importantly, agitated saline was used as a surrogate for adenosine, and these were healthy participants. It is unknown if our results would hold true in patients receiving adenosine for SVT. Finally, it should be noted that there was variation amongst the sonographers, which suggests a component of subjectivity to the use of ultrasound in confirmation of flush arrival to the heart. Thank you and enjoy the rest of the conference.